This vaccine equity video series is produced by the Public Health Alliance of Southern California. Our series elevates promising and replicable practices for equitable vaccine distribution. Practices happening both here in California and across the nation. Our video series will showcase community-informed and equity-centered practices that specifically aim to reach disproportionately impacted low-income communities and communities of color. My name is Marley Williams, and I am the Health Equity and Justice Manager here at the Public Health Alliance of Southern California.
And I'm Dana Sherrod, Birth Equity and Racial Justice Manager for the Alliance. The Public Health Alliance of Southern California is a coalition of the 10 health departments here in Southern California. Collectively, our members represent 60% of California's population.
In this video, we are joined by Salome Waga, epidemiologist with the County of Riverside Public Health Department, Alejandro Espinoza, Program Officer and Director of Outreach at Desert Healthcare District and Foundation, and Luz Gallegos, Executive Director of the Community Organizing Group TODEC, as they discuss their multi-sector, multilingual vaccination efforts to reach farm workers through mobile clinic partnerships, with funding support from the Public Health Institute's Together Towards Health initiative. Together, this collaborative has successfully vaccinated over 4,000 essential farm workers throughout the Eastern Coachella Valley and still counting. We know that the Riverside County Health Department is focused on identifying strategies for advancing equity during vaccine distribution and allocation. Can you tell us more about your partnership in the Eastern Coachella Valley to reach communities most impacted by COVID, and specifically farm workers and older adults?
The Riverside County Department of Public Health has always been dedicated to advancing health equity. So when it came to vaccine allocation and distribution, we initially formed a vaccine equity task force very early on and invited local CBOs, FBOs to the table, where it would be more of an information exchange, an idea exchange, and then addressing some of the needs that we could foresee within the community when it came to vaccine distribution. So with that said, we also utilize a lot of the data at our disposal, looking and working with the Healthy Places Index, as well as the fourth quartile data, and coming up with our own internal vaccine priority index, where it overlaid all of the previous data mentioned on top of case rates, death rates, and vaccine uptake rates. We were able to identify disproportionately impacted communities within the county, areas where we would like to have priority and concentration of vaccine dissemination and allocation. The Riverside County has a very large network and group of agricultural workers and farms.
Can you tell us more about your recent partnership effort with Desert Healthcare and TODEC to reach farm workers?
So one of the first thing that we did as an organization when we were approached by Riverside County Department of Public Health was look at our community partners who already were doing work, in regards to the response to COVID-19. And we decided to bring them all together to ensure that we had a unified response, a unified message, and maximize our resources internally to ensure that we were not duplicating efforts. We found right off the bat that a lot of the information that was being disseminated, for COVID-19 was, very technical, brochures, pamphlets, PSAs, etc. So by hiring and working with community-based organizations that employ community health workers, we were able to take, very complex and very technical messaging and, make it very simple for our community to learn and to understand. And, receiving the funding and be able to provide additional resources for these community-based organizations that at that point were struggling because a lot of their funding was being pulled back because of the pandemic. Also, utilizing our internal resources, we were able to augment, some of those grant dollars that were received to be able to expand on the work and increase the capacity of our community partners. The relationship that we at the district, at the Desert Healthcare District and Foundation started really early on in the pandemic in April of 2020 with the local growers, I think led us to, this amazing partnership with the growers and farm owners here in the Coachella Valley. We had monthly meetings with them between the Department of Public Health, the Desert Healthcare District, and the different growers, and just communicating with them what was going on in regards to testing, the vaccine, and just providing educational materials that they would disseminate, through paychecks on a weekly basis. And when we were doing, the testing, we would provide them flyers about, the different locations where we were testing. And, within a couple of weeks, they said, wow, why are we sending our farm workers to go get tested at these static locations? Why not bring, the testing to our locations? And that's when we started really ramping up the on-site, activities. We first started with the educational component, going there and providing, very simple education about COVID-19, some educational flyers in English, Spanish, and we also translated some educational materials in Purepecha. Here in the Coachella Valley, we have a large group of indigenous people from the state of Michoacan in Mexico that speak, their native language, which is Purepecha. We established the Coachella Valley Equity Collaborative, where we have more than 12 community-based organizations that, do work in different fields, from targeting youth to working with farm workers, doing environmental health. There are different expertise that are at the table. And we were able to leverage those partnerships and those relationships that some of our community-based organizations already had pre-established, and optimize those and be able to go directly into the fields.
Our communities are used to seeing Border Patrol patrolling our streets, separating families. But what we were not used to is a pandemic. So right away, we started elevating the realities and the voices of our grassroots to government. We aligned our advocacy with grassroots community education. We have been going to the fields since last year, talking to the workers, letting them know the advocacy that we're doing around vaccines, and letting them know, because even back then we were already hearing myths and rumors about the vaccines and workers. When we go to the fields, the first thing we ask is, are you ready to get vaccinated? Nobody raises their hand. By the time we're done with our community education, you see everybody raising their hand.
On our end, we have the responsibility to allocate, whatever doses we get on a weekly basis, allocate a certain number, and we've been dedicated to allocating a certain number of vaccines for the Eastern Coachella Valley mobile team. With that said, of course, we have other mobile teams in the West that are addressing ag workers as well, and, multiple stable sites, but currently we're looking at 350 doses per day for the 5 full days and running 5-day clinics. We provide all of the nursing staff, of course, the entire mobile team, the staff that are actually doing the injections. We have very strong communication with the growers through Alejandro and this partnership, and kind of evaluating how many growers there are, how many staff members they have, and being in constant communication of who we are serving, as well as keeping track of when we're going back for second doses. So all of these, the Eastern Mobile team will be vaccinating on the farms and or with the partnership with the local parishes, going to the churches to provide those vaccinations, but also returning for the second dose as well. So ours is more of the funding, and then the structural individuals and kind of identifying locations as a partnership. And I think we forgot to mention that we've been scheduling these vaccine sites during work hours. I think that's something that's huge. Growers are allowing their workers to go during work hours, so they don't have to find a means of transportation. They don't have to find the time to get vaccinated after work or on weekends, but actually when they are at work.
The growers have been, tremendous in hosting these events. And some of them, they use their HR departments to do the registration. For anybody looking to replicate this kind of model, working on those relationships with your local growers, because they're the ones who are definitely going to be the catalyst for any kind of work that we're trying to do. Also in our communities, there's a huge digital divide. It became a really daunting task, especially if you're not used to using a computer on a daily basis. So those are some of the issues that we slowly started addressing. The transportation, it says, well, let's bring it to their workplace. Why don't we have volunteers and community health workers come to where they work and, negotiate and talk with the growers to give them an additional time, to come out and get registered for the vaccine. And that has yielded tremendous results. And it's very easy now for a farm worker to show up in any of our events. We do pre-registration a couple of days prior to any vaccination event that we're hosting on site. And then we also provide them instructions. We answer some questions, debunk some myths. Our acceptance rate now for the vaccine has slowly increased because we're out there as a trusted messenger and providing that information. And now when they come to these sites, the first person that greets them is a community health worker that speaks their language. And I think that also kind of reduces their anxiety when they show up to these vaccination events. And, they feel a little bit more confident.
And our teams go out with their iPads or our tablets to actually register the workers and also give them instructions as far as what date and time, location, and what to expect. Our teams have been going to support the county public health workers to actually screen some of the workers, also providing translation services. They see our faces, they know who we are. The nice thing about this operation is that the public health through Salome and Desert Healthcare District, there's already organized follow-ups at second doses.
Alejandro, myself, and the growers work really closely to make sure that we have second dose allocations. So what we do is go back to the same locations and provide the second doses. The links that are created for pre-registration are only shared with Alejandro's group, and then, whatever community worker like TODEC, whoever is assisting with pre-registration. This is not a widely shared or advocated link for registration, so that we make sure that we stay within our targeted population.
How do you see yourselves really building on this effort? Salome, you talked about, hoping to get a second mobile clinic, but what is that? Can you just talk a little bit more about that? What does this expansion look like?
After being kind of recognized for this work by the governor, hoping and praying that we'll get additional funding to move the work forward. And also, I think it's a great collaborative moving forward, and it shouldn't just end at the end of the pandemic. This should be something that we should continue, whether it's, continued through flu vaccinations or any additional information dissemination and continued collaboration as the years go on. Building that bridge and closing some of the gaps and power sharing between local CBOs, foundations, as well as the Department of Public Health and Emergency Management Services.
I think moving forward is trying to find different partnerships aside from the county, because there are also, private, federally qualified health centers and hospitals that also, receive, X amount of vaccines from the Department of Public Health.
We need to continue creating awareness and debunking the myths, not only educating, creating awareness and supporting the different operations, but also to continue elevating the realities and best practices. It always has to start from the bottom up. And that's how it's been here with the vaccination rollout in our county. And we are just so proud of being Riversideans, and we're so proud of our county. Being the first county in the whole nation to prioritize workers, that's something that we are very proud. But we are very proud of our county because they listen. They listen to us. They shift gears. They understand that they need to listen to organizations like us, because we are hearing it directly from the community. The funding was a blessing, because literally we were doing this as a grassroots effort before we received funding from Desert Healthcare. One person cannot do it all, and it takes a partnership like this that we have here in the county. With Salome, we're talking at high numbers, late hours, and Alejandro has always been there for each other. So, and we hope the work that we started here replicates across the state and across the nation.